Good morning again, and I want to thank you for being with us today. My name is Davelyn Patrick, and I'm the Community Resource Specialist here at Families Helping Families of Southwest Louisiana. We're pleased to welcome you to this very important webinar, Changes to Your Louisiana Medicaid Plan for 2023. We're really lucky to have Ms. Karen this morning. She's done a lot of work to bring this information to you, so I'm excited that you're here. I want to make you aware that this webinar is being recorded. Before we begin today, I want to introduce you to my coworker, Ms. Melinda Elliott. She wants to take just a few minutes to tell you about a very important program here at Families Helping Families of Southwest Louisiana. I'll give it to you, Ms. Melinda.
Thank you, Davelyn. Like Davelyn said, my name is Melinda Elliott. I'm the Region 5 LaCan team leader. LaCan stands for the Louisiana Council's Advocacy Network. It's a grassroots network of people like me and teams of people that care about people with developmental disabilities. So it could be the person with the disability themselves, it could be parents, it could be family members, it can be and is providers, people that are interested for whatever reason. One of the main things that I do is find people that are interested or have a good story about our legislative agenda every year. Because our goal is for people to live and work and go to school and do everything that everybody else does in the same place everybody else does, but with supports. So every year, LaCan, the statewide organization, comes up with an advocacy agenda, and then the Louisiana Developmental Disabilities Council actually makes the final decision on the agenda. And I like all the other LaCan leaders, I like to find people that have an interesting story about those issues. The Louisiana Developmental Disabilities Council will actually be making decisions later in this month. But in the meantime, you can join because you learn all kinds of interesting things, whether it's about services like waivers, flexible family fund, individual and family supports, or education, the April Dunn Act, ABA in the schools, restraints and seclusion, what else? Oh, just lately, cameras in the classroom. The Louisiana Department of Education has released the funds for the school systems to come up with the policy and put cameras in special ed classrooms if the parents request. Anyway, if any of those kind of things sound interesting to you, you can go to that link that Wallace is posting in the chat box. It's free. You're basically signing up to get email, learn about how things work and what's going on. Of course, if you sign up, I'm hoping that you will send emails to your policymaker, because none of this is any good if we don't touch the policymakers. They don't know, and they have hundreds of pieces of information coming to them. So it's at least partially our job to make sure they understand what our lives are like. So maybe you'll tell your story. I have a legislative roundtable every year. All 10, well, there's 9 leaders like myself. One of us covers 2 regions. Though there are some vacancies. If you're not from this region, you might want to check if you're interested. But we have visits with our lawmakers where people tell their story. There's lots of opportunity to just chat and tell your story. If you have any questions, let me look in the chat box real quick. Chat me up. And there, Wallace, he posted the link. He's good. And I'm done, Davelyn.
Thank you, Ms. Melinda. I appreciate it. I would like to take a moment to review some housekeeping items with you. Before I introduce our speaker, all participants will be muted during this webinar. If you're having difficulty hearing, please send us a message in the chat and we'll do our best to help you figure out how to address the issue. If you're disconnected for any reason, please call in using the telephone number in the email you received upon registration. Our presenter will be answering your questions at the end of her presentation, so please send your questions by entering them into the chat. Again, we will be recording today's webinar. In the next week or two, you will be able to find the recording on the Families Helping Families of Southwest Louisiana YouTube channel. You just search FHFSWLA. Please consider subscribing to any webinars that we record in the future will go there. After this webinar, you'll have the opportunity to provide us with feedback about this experience. And we value that feedback and would love to hear what you thought about today's webinar. So with no further ado, I want to introduce our speaker this morning. Ms. Karen Scallon is the owner of Special Needs and Parent Support Services of Louisiana, LLC. She provides services to individuals and families of children and youth with disabilities and special healthcare needs and the professionals who serve them. So thank you for sharing with us today, Ms. Karen. I'm going to stop sharing so that you can share and we'll get started.
All right, thanks, Dablin. All right, so let me try to share my screen now. Oops, lost you. Let me go back. There we go, share screen. And all right. All right, Dablin and Wallace, can y'all see my screen? I just want to be sure.
We got
All
you.
right, awesome. So we're good to go. First of all, I see we have like 22 people. I'm so glad that we do have a good number of people that have signed up for this today. I will be presenting this topic again next week. I may have updates. If I do, I definitely will send those updates to Dablin, and you'll see why as we go through this presentation, why there may be some updates to the information I'm giving you guys today. So, all right, today we're going to talk about some changes that are coming for our Medicaid plans in the near future. As Dablin said, I'm Karen Scallon of Special Needs and Parent Support Services. This is my contact information. You'll also be able to get a copy of this presentation or the recording, so you can jot that information down from there. And you can connect with me through the helpline, the new Gmail address, the SNAPS-LA helpline at gmail.com, or through Facebook. You can also find some good information I have out there on Twitter, Instagram, Pinterest, and my website. So as Dablin said, I am going to ask specifically for this presentation that you do hold your questions to the end, because there's a good chance I'll be answering it. And there's also a good chance that we won't have an answer. So there's a few things that are still kind of left unsaid, and I'm waiting for replies from Department of Health on those things. And we'll talk about that as we get to them. All right, so the first thing is, instead of open enrollment for this year only, Medicaid is going to do something new. They're going to do an auto assignment of most recipients, not everyone. That auto assignment is going to include a new health plan option, Humana Healthy Horizons. We're not getting rid of any of the 5 plans. We're actually adding a 6th plan. This is not going to affect your services in the sense that all plans are required to have the same services under their Medicaid contracts. They have to have all of the basic Medicaid services. They can add services if they want, but the basic Medicaid services all have to be there. Now, that said, we're going to talk about prior authorizations a little later, but in general, all services must be exactly the same. And this has nothing to do with your dental plan. So if you're getting the new dental service from MCNA or DentaQuest, you'll remain wherever you are within your dental plan assignment. Don't worry about that. So these letters are going to start going out soon, very soon. Toward the end of October, people are going to start getting the letters. We're going to talk about what's going to be in the letter in a minute. The changes take effect January 1 if you're already in Medicaid by the end of the year. And you'll have an extended period of time within to go change back to where you were or change to another plan. So that part of open enrollment, that part of that same process we usually have in open enrollment where we can change no matter what. We don't have to have a reason or a for-cause reason. That's going to kind of be the same, except we'll have more time to do that. So that's good. If you want the plan you are assigned to in your letter, you don't have to do a thing. You don't have to worry about any of this. You don't have to worry about it at all. So this is what it's going to look like. As of January 1, we'll have 6 plans. Legacy Medicaid will still exist for those who choose it, and you can move in and out of Legacy Medicaid with your healthcare services in and out of your plan and Legacy on a monthly basis. You don't have to wait for any open enrollment. You don't have to have a for-cause reason. If you're going to do that, though, call me first, because there's a few little cautionary things you need to know about. But the 6 plans, of course, are going to be Aetna Better Health, AmeriHealth Caritas, Healthy Blue, Humana Healthy Horizons, the new plan, Louisiana Healthcare Connections, and United Healthcare Community Plan. That's what we'll have. So as we said, the letters are going to start going out late October. They are going to, and they're going to keep going out. I mean, they're going to be sending them. There's a lot of people that are going to be receiving these. It's going to go on for months. The letter is going to explain to you, this is the plan you currently are enrolled in. And this is the plan we're going to enroll you in as of January 1st, 2023. Now, this is not going to apply to everybody. Some people are going to be auto-assigned to the plan they already have. So it'll say, hi, Jane Smith, you have AmeriHealth Caritas for your health, from managed care organization for Louisiana Medicaid. We are auto-assigning you in AmeriHealth Caritas, the same exact plan. It's going to be the same thing. Some people will be auto-assigned to a different plan, and that will be a big chunk of people. And then some people are going to be excluded from this auto-assignment process altogether. Now, who's going to get excluded? So excluded from auto-assignment remain with their assigned plan and legacy, if that's what they chose, if they're in legacy. So that will be people who are just carved out of this process, people receiving case management. And I have that highlighted for a reason, because I want some clarification on that. We'll talk about that at the end when I get to kind of the questions. But recipients in receiving case management services, recipients involved with DCFS, Department of Children and Family Services, recipients with the following conditions: cardiac issues, asthma, behavioral health, Chisholm class settlement members, high blood pressure, diabetes, cancer, high emergency room users, and others, to the degree Medicaid is able to identify the high-risk enrollee. So there will be high-risk enrollees who are changed in their plan. But that, again, is to the degree Medicaid is to identify them, and they are not saying they're carving out all high-risk members. So there's some gray there that I still have questions about, and I'm hoping for clarification soon on those. So we're going to talk about that in the question section at the end. So why are they doing this? Well, because we added the new plan. This is going to provide all 6 plans with a minimum of 150,000 enrollees as of day 1 in order to facilitate viability of the new plan. And I kind of see it. I can understand from a business standpoint, if we just say, hey, y'all can choose 6, most people are already in their plan. They're not going to move. If the new plan doesn't have enough enrollees to make the contract, viable, it's not going to work. So I can kind of understand that. Do we have to go through this again every year? No, thank goodness. This is going to be a one-time and done, because when they issue those contracts to the managed care organizations, they're for a multi-year period anyway. We're not going to have to do that now. Fall of next year, around this time, it's usually October and November. There'll be another open enrollment opportunity for people who are coming into Medicaid, or anybody that wants to change. Anybody enrolled in Medicaid, they'll have that open enrollment. It'll be just like we did before. This is going to be a one-time thing. So how are they going to assign people? So of the enrollees that they identify as ones they're going to auto assign, they're going to start first assigning people to the managed care organization with the lowest enrollment numbers, which is going to be first, it's going to be the Humana plan, of course, because they're brand new. Then they'll go as follows. They'll look at the family as a group and try to keep the family in the same plan together. Then they'll look at enrollees 19 and over, then children, then by zip code, and then alphabetically. So that's kind of how they're going to look at the auto assignment. And like I said, starting with that brand new plan to reassign people. So what does this change for the managed care organizations? Not a lot. They still have to report their target deliverables. They still are responsible for designing and having a level of care program that's based on the performance goals they've been given in their contract. They still have to provide all of the required services that Medicaid requires in our state plan array of services. That's actually federally required because they have to provide the service, all the services Medicaid provides. The change is going to be really for providers to understand that there is a new plan out there, decide whether they're going to take it, look at their clientele, discuss it with their clientele, work with that managed care organization to get all their certifications in and everything done prior to the January 1 start date for current enrollees, so that we can have as seamless as possible, provision of those services without any barriers to care or problems. The provider agencies are going to have to do some work. They're going to, of course, have to consider enrolling in the new Humana plan. They really need to communicate with their patients about what plans they're going to take or they're not going to be taking. They need to double check the effective dates on the enrollees' coverage and look at what their coverage is and if a new prior authorization is necessary. And I'm going to talk about that a little bit. That was one of my questions for Medicaid about prior authorizations. I'm going to focus on that a little bit more in the question section, but it's going to be incumbent upon providers to really work with the managed care organization that the ones that they are enrolled in, and work with their clientele as far as what they take, what they don't take, and what changes that might mean for someone who they've been seeing for a while. And I'm thinking, in terms of those doctors that we regularly see, but also those therapy providers like ABA, PT, OT, speech, who generally have a 3-month or so prior authorization to deal with. So what do you need to do as a Medicaid recipient? For right now, my most important message to you is to call Medicaid, look up on Medicaid, call Healthy Louisiana, do whatever you have to do, talk to your plan that you're in, make sure they have the correct mailing address for you. And I am going to say, make sure OCDD also has the correct address for you. If you are on the waiver registry, but do not have a waiver yet, OCDD in the meantime is going to be sending out letters to those registry members asking them if they want to continue to remain on the registry. They can, it's fine, it's just fine. We just are looking at people who have moved out of the state, for instance, since the hurricanes in Lake Charles, and then hurricanes, of course, in South Louisiana, South Central Louisiana. if we've had some people have moved out of state, and if you're going to stay out of state, then we need to know. This would be people who got a 0, a 1, or a 2 on their SUN assessment, and they're on the registry, or people who just got their statement of approval or will be getting a statement of approval. They just applying for those waiver services at their human service district. Maybe they haven't gotten their SUN score yet, and they haven't done it yet. So those are the people that are on the registry. They are the ones that will be getting this letter from OCDD. Very, very important that you make sure that OCDD has your correct address, your human service district has it, and your support coordination agency, if you have one. Make sure they all have that correct address so that you can receive those letters that are going to be going out. So just throwing that in to kind of help, I guess, muddy the waters a little bit here. So when you get your letter, don't throw it away. I really want everybody to keep those letters just in case you have a problem, and you find out that something's different than what you thought it was going to be. Read it thoroughly. Compare the plan that you have to the one you've been assigned to be sure where you are. And I believe they will be sending along with these letters, the comparison chart. That comparison chart that gives you like all the layout of the extras and the little pluses and perks that each of the plans give you. Don't rely on that to make your final decision. Find out where your doctors are going to be. Where are your therapists going to be? Are they going to take the plan that you've been re-enrolled to or you've been auto-assigned to? Are they not going to take it? Are these therapists and people that you definitely want to keep on your care team? If that's the case, ask them, what they're keeping and figure it out from there. But please don't base it just on the perks, because you could run into big problems later. So hang on to that letter. Decide whether you want to keep the assignment change if you are changed. If you want to keep the new assignment, or you got assigned to the plan you were already in and you want to keep it, you don't have to do anything at all. But if you do want to change from the plan you're assigned to, you can contact Healthy Louisiana. This is the phone number. You can call them Monday through Friday. You can do it online. They have an app. You can do it through the app. There's lots of ways to do it. So, if you want to make that change within the opportunity to make that change, that period we're going to be given, then make sure you're contacting them to make your change from what's on the letter. Now, please, if you do call them and make a change, and I didn't put this in writing up here, but I'm just going to say, it's just like anything else. Write down who you talk to, write down the date you talk to them, keep track of that a little bit, just so we can make sure that you're where you want to be or you need to be, and that those changes were put through accordingly. So how long do I have? You're going to have an extended period of time. It is longer, and I'm going to give you a chart with the dates. You're going to see that in a minute. You'll have a longer opportunity than we usually have for auto enrollment. I want to say auto enrollment opportunity, that window is like maybe 45 days. I'm not sure exactly how many days we're getting this, but you're going to see on the check on the chart where you are and what we can do as far as how long we have to make that plan. But just know this: after March 31st of 2023, whatever plan you're locked in. You will be locked in unless you have a for-cause change. Now, just so in case you're not familiar, a for-cause change is you have a reason to move that has to do with your ability to access care. If you have one plan you were assigned to, you need a certain specialty care, or you need, it could be things like you need an ABA provider, and the plan that you were auto-enrolled to doesn't have the provider you've been seeing for a year, or you a provider that the only provider in your area that really provides this close by is not in the new plan you were changed to. If that happens, those are for-cause changes. And you can call that enrollment number and ask them to do a for-cause change. I'm finding that if it goes through that channel, it does sometimes take a little longer. But by all means, you can also call me and I can help you with that. So I think it's a little quicker going through my direction. I know that there was some things that people had to do if they went through when they called the phone number for a for-cause change. They had to send a letter, they had to document things and that kind of stuff. But again, if you want to call me, I'm happy to help with that. So this chart, this is an important little chart. This is how you tell when your changeover will be effective. If you change and because this is for all changes after November 8th are going to be affected by this. So November 8th through December 29th at 6 p.m. January 1 is the effective date of your plan. And that's January 1, that's what you'll be enrolled in. And that's when the change will go into effect. After 6 p.m. December 29th through January 30th, you'll be effective February 1st, and on. January 30, 6 p.m. through February 27, 6 p.m. March 1st will be the effective date, and they give some beyond that all the way through effective dates of May. Now, after March 31st, though, you must have a for-cause reason to change plans. So let's say you make the change November 8th. It's effective January 1st. You start going to maybe a new provider January 1st. And then all of a sudden that provider closes, or, you're not able to get that service or that service from that plan. You want to make another change. You should be able to, as long as it is before March 31st. No, excuse me. Yeah, March 31st at 6 p.m. You should be able to change it again. Now, just a caveat, and I'm not trying to confuse anybody, but so if you need clarification for this when we get to the end, just let me know. But for legacy, if you just want to move in and out or out of your Healthy Louisiana plan for your health care into legacy, and you're eligible to move to legacy, then you can do that at any time. It's anytime you can go back and forth. If you do it, there's some little cutoffs, you can't do it the last day of the month to have it affected the first day of the next month because it's too close in time. But, it's usually effective the first of the next month. And that's just for legacy for people who are optional in legacy. Your optional people in legacy generally are people who are waiver recipients, both through Office of Citizens with Developmental Disabilities and Office of Aging and Adult Services waivers. All right. So how do you change your plan? Again, we talked about that briefly, but there's 5 ways. You can go online, create a login, do your enrollment there. You can download the mobile app. You can call by phone. And again, that was Monday through Friday, 8 till I had 5 on there. You can fax in the enrollment and you can send it by mail. So I'm going to suggest to people, if you do it through online or on the app, you're going to be able to see that it was done. Then I would say go back, check, make sure, on the date it's supposed to be effective, make sure it is effective, that kind of thing. If you call someone to make a change, write down date and time, write down who you spoke to. Those calls can be pulled, and if they're recorded, if a change wasn't made and it was supposed to, I think they're all recorded and they can go back and pull them and verify that. And then it's relatively easy to get them to make that adjustment. If you fax it in, keep your confirmation. If you send in the information, I mean, you can't, I don't think you can certify to a PO box. But if you send it in, I would certainly double check that it was actually changed. And you can do that by going in and creating an account and logging in at the link at the top. And that way you can go in and see where the assignment is, where were you assigned, and see if that assignment had been changed to the one you mailed in. Okay. Now, remaining questions. So the following questions I'm going to go over, I composed based on a presentation that was given to provider agencies. Their presentation was a little bit different. It didn't have a lot of the information that pertains to people who are using Medicaid, but to the providers and what they had to do to enroll. I've submitted this list of questions to Department of Health. I'm waiting on their reply. I'm going to be posting the answers to those questions as I get them. They're supposed to be compiling them for me, but they didn't have it in time for this presentation. So one of the first questions I have are auto assignments in the included excluded populations. What about those prior authorizations? If I am getting ABA therapy and I am using Louisiana Healthcare Connections, just finished getting a new prior authorization for another 3 months of services, and I get auto assigned into Humana. Is there a provision where Humana has to honor, or any new plan has to honor, prior authorizations from the previous managed care organization? I'm waiting on that to see. Sometimes that'll be an across the board. The prior authorization has to be accepted, and hopefully that's the way it will be. If it's not, we're going to have some work to do if people are changed to really, and so will the providers, to really help those individuals either go back to their plan that they had or get a new prior authorization if they're staying with the new plan. Also, will individuals with legacy be reassigned to an MCO? Are they in the exempt category? I'm kind of hoping that they will be in the exempt category, because I think that would be a lot easier for most Medicaid recipients. But anyway, waiver recipients, will they be part of the high-risk populations? And a lot of this has to do with not so much who you are and where you are in the system, but how is the system able to carve those individuals out or not in a way that Department of Health is sure that that's exactly who they're getting. Like, you can plug in a cancer diagnosis and say, do this, but exclude all these people into an algorithm. Can they do that for these other things? And I want them to elaborate on the Chisholm class settlement members, how this is going to be determined. They also had a statement in there which didn't make sense to me. So I've asked for clarification. In this presentation, there was a statement that said, to the degree that Medicaid's able to identify high-risk enrollees, which is a clue that it's not always possible to identify all of them. Example, this is continuing with their quote, example, enrollees who may be ineligible at the end of the public health emergency, Medicaid will determine a means to disperse those enrollees across MCOs. So I don't really understand enrollee who may be determined ineligible at the end of the PHE. If they're ineligible, what difference does it make? They will be out of Medicaid. I'm not really sure. So I just asked for them to clarify that statement. I also asked them to explain the statement that the department seeks even enrollment categories across plans, not a level of enrollment. And I would like them to explain the categories. I think I know what they're talking about, but without getting direct information from them, I hesitate to go into any in-depth, but I believe this has to do with the categories of individuals, your Medicaid population, those with complex care needs, those, there's some that they get a higher per person per month rate on. I think those are going to be some of the categories we're looking at, but I would like them to elaborate on those categories so we can kind of have an idea. Now, regarding that chart and the enrollment cutoff dates, there was some information that was given to providers that said, it seemed to be contradictory. It said before December 1st, people have access to the 6 plans, but then those who were retro eligible determinations before December 1st only had access to 5. And if they do select Humana, their effective date won't be till January 2023, which doesn't make sense to me because if they're retroactive, you can kind of see where that's going to be hard to understand. So I asked for some clarification on that. Why would there be access to different sets? Many individuals new to the waiver systems get those retroactive eligibilities. How are they going to know that, oh, if I pick Humana, not getting my stuff until January 1st, not access to services. But if I pick one of the other 5, I can get healthcare services before that. So and potentially past due invoices, because those retroactive dates also include any outstanding bills that you may have. And will these populations or any populations be notified their effective date will be 1/1/23 if they select that Humana plan, as that statement in the very beginning of the question says, eliminating retroactive coverage. Like, they have to be notified that by choosing that plan, they're not going to have a retroactive coverage if that in fact is the case. Now, the other thing that this presentation mentioned is that they're working on moving the entire state to one single PDM. So right now for prescription drugs, we have one preferred drug list. It is one master list that all of the plans use on to determine, is this medication eligible for payment by Medicaid? A PDM would be a preferred drug management company, which would be a separate entity to manage prescription drugs as opposed to the plans. And I'm wondering, what exactly is that going to mean for recipients? Are you going to have a separate card for prescription drugs? Excuse me. Are you going to have a separate card for it? Does this include people in legacy Medicaid? What exactly are we talking about for that prescription drug management team? No dates were given, no indication of when that would happen. It's just something that the state's working on, so I'd like to get some more information about it. So some additional questions I came up with as I was working on this. So if a recipient receives case management services and case management service recipients are excluded, how much assistance constitutes you getting excluded from this auto assignment if you receive case management? Because some people don't receive a lot of case management. Sometimes the case manager just arranges some travel for out-of-state care, or and once that's done, it's one and done. Sometimes they're extremely involved with working as a liaison between doctors and different other providers and the health plan to try to get care, especially on the mental health side. So I'm kind of looking at a threshold, or if there is one, that would mean somebody would be carved out of this auto enrollment because of use of case management. Regarding people involved with DCFS being excluded, can they give me some more information? Is this only children with open DCFS cases, those in foster care? Give me some more information. So what I'm going to ask you guys now is what questions you have that haven't been answered here. What have I not thought of that is really important to you guys? Because I want to make sure I'm getting all these questions answered. The 2 on the screen there, I haven't presented yet. I just really kind of, as I said, in reading this over and over and over, came up with these two as well. So I'm looking in the chat right now. Let's see. Okay, so the first question really is a general question. And Faith asks, am I referring to regular Medicaid or long-term care Medicaid? This is all Medicaid recipients will be involved in this. There will be long-term care Medicaid recipients as well who will be auto-assigned. But it will not affect any of your long-term care services. It only has to do with the assignment of a managed care plan for healthcare and behavioral health services. Okay, so Faith would also like a number for the Lacan lady. So Miss Melinda, I hope, oh, good, you posted your number there. All right. And Wallace posted a link to what long-term care services are. So a resource list of service providers that accept different Medicaid plans so parents can know what professionals to look into and the services they provide. That would be so huge, and it changes really, it can change any day. Providers have an option to take a plan or not take a plan. They may have a clause that tells them if they quit a plan, they may have a 30-day notice that they have to give the plan or the recipients or something, but they can generally determine to not accept anymore at whenever they want to. They can start telling people that they don't take it anymore and just deal with the people they have until they that's gone by attrition. So it really would be kind of impossible, Miss Alexandra, to have a list like that. There is a resource though, and that same slide, I'm going to go back for a minute, that talked about how to, I'm trying to get it to go back. Yeah, here we go. That talked about, here, this one. This slide here talks about how to make a change. This number here and at their website, I don't think it's it should be myhealthyla.gov, myplan.healthy.la.gov without the enroll on the end. If you go to that website or call this phone number, they can look up doctors for you and tell you what doctors are in each of the plans. They are official counselors for that. I would say you verify it with the doctor that they're going to continue with that plan. But that's pretty much the only way you're going to get that answer is either by calling that number, going online, and or talking with the doctor. And for me, I think I would do both. Go to Healthy Louisiana and also talk to the doctor. So Wallace asked, do I mean something available that compares the 6 different Medicaid providers that are offered? The only thing that's available that compares the providers is there's a comparison chart of the perks that they all offer. And there will be one coming out with Humana that will be included with the letter that you get. So all of them will be there. You'll be able to see which plans give like a little card for a well visit check every year and what, that kind of thing. But you're not going to see like doctors and that kind of thing within that. Okay, so yeah, David responded to that question. So Faith also asked, what is legacy Medicaid? That's a really good question, Faith. And, I went on the assumption that people knew that, and I apologize for that. I should have defined that. So legacy Medicaid is Medicaid in the old fee-for-service system. Before we had all these plans to deal with, and we went to basically what looks like a regular insurance plan run by insurance companies that manages the healthcare we get through Medicaid, we had just one fee-for-service system. And what would happen is you go to a doctor cares for you, takes the bill, submits it. You go to another doctor the next day for the same thing, he takes the bill, he submits it. With the managed care organization, they can look at that usage. They can do a lot more as far as managing that kind of stuff to keep costs lower. Legacy Medicaid for healthcare services only does still exist. Fee-for-service Medicaid still exists only for healthcare services. The entire behavioral health system had already been privatized into managed care when we got, it was Magellan Health had the contract. I can't remember what we called it. There was some branding name that they gave it for behavioral health. So that's all Legacy is. Not everybody is eligible to use Legacy, but Legacy was an option that I fought very hard to keep for Medicaid waiver populations, for people in that long-term care Medicaid waiver system, because not everybody can get what they need from a managed care plan. And because I want to think how to put this accurately. Give me a second. So back a while ago when we were going through all this change, they presented to us the possibility of putting all of our waiver populations with no option to keep Legacy Medicaid or fee-for-service Medicaid. And the argument to have the option remain open is that there is no definitive proof that it will serve them better and save the state money or save the state money. There's no definitive proof that having your care in a managed care plan will save money. There are people who have very complex medical need, a lot of durable medical equipment need, who can only get their care through that Legacy Medicaid because there are providers who will only take that Legacy. And a prime example is the Ken's Thrifty Way, which is a very large durable medical equipment company in Acadiana, and they serve people all over the state. They only take Legacy Medicaid, or at least at last word. So Kate and Faith, who had asked about Legacy, please let me know if you still have questions about that. So Precious said she was referring to ABA OT speech services. And that was with regard to, to looking at providers. Yeah, as far as Precious, as far as finding and knowing the providers for any service, not just a doctor, you're still going to go back to that phone number or that link that's on the screen right now, and they can tell you who's in which plan. Other than that, there's no way to be able to handle all of that. What determines the extent of involvement of case management? I mean, it could be your need. You know, there are times when I have seen case management do some good work when they were able to get more information directly from, I would say, an inpatient mental health provider on whether somebody should be discharged or not. And maybe there's somewhere in the plan they're trying to discharge, or somewhere at the provider's office that's trying to discharge, and the family disagrees, you know, or the individual disagrees with discharge from an inpatient mental health facility. Case management can do a lot in that regard. Your insurance, even private insurance case managers do that a lot. Other than that, you may only need them to navigate some out-of-state care. Travel for out-of-state care. They can also be very involved. If someone has really complex needs, they also can be more involved if you're having trouble accessing a provider. It's their job to find a provider in that network or out of that network to provide you the care that you need. So they, you know, it really just depends on whatever the person needs. It depends on the extent. What if they choose a new provider, and one of your doctors is not in network with them? Okay, so Ms. Barrow, if they they're not going to choose you new provider. They're going to change your managed care plan, which one of your doctors may not be in that network. And if that happens, you're going to have the opportunity to go back to the plan that you have right now. And you will have that opportunity up till 6 p.m. on March 31st. If you know, though, after, by November 8th or November 10th, or even December 1st, that this plan isn't working for you, change it as soon as possible. Don't wait that long, because you want to be able to have your doctors if you need them. I see Davelin put the link in there. Thanks, Davelin. I appreciate that. So you're just going to make a change within this period that we're allowed to make those changes, and you can go back to your plan. It's certainly up to you. Like I said, please check with your doctor's office as well. You can call the billing office. A lot of people don't know they can do that. But if you call and talk to your doctor's billing office, they usually have more information. There's usually somebody in there who knows everything about Medicaid. So Kelly says, will the changes affect recipients who have legacy Medicaid and a plan just for behavioral health services? That's actually one part. I worded it a little differently, but that's actually one of the things I asked them. I don't necessarily know that legacy Medicaid recipients will be carved out. So I'm really kind of not sure to answer you. Honestly, I'm really not sure at this point. So let me just make sure that I have that question down the way you've asked it. And I'm just going to write that down. Give me a second. And Kelly, I will be getting back to everybody about that. And thanks, Wallace. Put the link in again. Michael Altazan says, if we are reassigned to a different plan and really need to stay in our existing plan due to current providers, will it be a hassle-free process when we request to remain in our current plan? So I can't guarantee that it'll be hassle-free, but it should be without too much conflict or issue. But just in case, due diligence. We're advocates on here for our kids, right? We advocate at school. What are some of the things we do when we advocate in school, or we advocated if your kid is out of school now? One of the things we always did, keep copies of your letters, write down who you spoke to, make sure you keep records of when things were done. If you go online and you make this change, you should get some confirmation that the change was made, but go back into your account and double check it. Go back into your app and double check it, the next month, and make sure that it's been changed. And then if you do have any problems, let me know, because I really want to get in front of those problems and get those changes done quickly so that nobody has any, we don't want anybody to have barriers to service. Yeah, and Davelin says you can call their office as well for questions. Who qualifies for legacy? Faith, that's a good question. Mostly it is individuals. The optional people are individuals who are on the waiver registry and who already have Medicaid. Individuals who have a Medicaid waiver, those are the optional individuals. Once you have Medicare and you're dual eligible, you're required to have legacy. If you're dual eligible Medicare and Medicaid, even if it's long-term care Medicaid, you have to have legacy for your health care. Let's see, Kate says, does it make sense to have Aetna insurance primary, private, and Aetna Medicaid secondary? So that's a question I get kind of frequently, Kate. It really makes no difference whatsoever. It's not going to be a plus either way. The two entities are really different entities because you're you have an Aetna insurance plan that might be through, let's say it's through an employer, that might even be an employer plan that they're actually paying for, that Aetna is just administering, and your Aetna Medicaid is really Aetna Better Health, which is a subsidiary or a different sub company. So it really doesn't make a difference. It doesn't help at all or hurt. It doesn't hurt either. Wallace asks, is legacy Medicaid still offered to people who are trying to enroll in Medicaid and have not been in Medicaid before? Well, it will be, Wallace, if, let's say your child is on the registry for a Medicaid waiver and you apply for Medicaid through the new TEFRA option and you get it, legacy should be an option. But what happens is, I think in that case, they may get enrolled in a plan and then they just have to make the change to legacy. A letter actually comes out when a waiver, when a person has Medicaid and they go on the registry for a waiver service, a letter goes to them and says, hey, guess what? You're on the registry now for this Medicaid waiver. And so you now have another option. You can have your healthcare and legacy. And thank goodness they put my phone number on that, because I do get a lot of calls saying, hey, what is this legacy thing? And is this something I want or need to do? So it is an option if they are someone who is eligible for legacy, meaning on the registry or having a waiver. Beryl, sorry, that's what I meant. Oh, I answered another question, I guess inadvertently. Okay, great. Oh, thank you, Kate. Kate has some nice words. All right, so Dalen says, can you tell us when the next webinar with this information is scheduled? It is actually scheduled, I believe, for the same time next week on Wednesday. In fact, I will triple check that for you. No, it is next Wednesday at noon. So it's going to be at the lunch hour. That might be better for some people that work. If you want to register for that one, to see if there's anything new or just kind of be refresher on it, some of this stuff, you can register for that through Families Helping Families of Greater New Orleans. So that would be where you go to register. And I think we've gotten to the end of the questions. And let's see how we are for time. Not bad, not bad. We have until 11:30. I'm gonna go out to the end. I want to thank everybody for logging on and staying through this, because I do understand that this information is, I'm working my best to make it as simple as possible, but it's a very complex idea in a lot of ways, especially when we start getting into the dates and the cutoff dates, and you got to do it by this date, but then this group is going to, it's just very complex. So thank you for bearing with me. If I have answers to those questions before next week, I will be posting them. Please feel free to join me on my social media. Let me go back one so you can see that. I will post things. I'm a little slower to Instagram and Twitter and Pinterest, but Facebook, usually I can get my updates on there pretty quickly. So check my Facebook page for anything about new that comes out about this. And then as more changes come, more questions are answered, I'll schedule more trainings with some of the centers. All right, Davelin, so I think that's it.
Okay, guys, if you think of anything, like if you get off this webinar and you're like, oh yeah, what about such and such that wasn't covered, please reach out to us so that we can get a message to Ms. Karen, or reach out to her directly. She's really a fabulous liaison between families and Medicaid in a lot of instances. She has a lot of knowledge. And so there are going to be things that come up that maybe she hasn't thought of. She's working towards all the things, but everybody's got different situations. And it's kind of like, when we go through a change like this, it's hard from a programmatic side for Medicaid to anticipate every scenario, because we are individuals. We're not all the same in Medicaid.
So, and honestly, you know, you guys help me so much because interacting with all of you guys, it helps me to tell them, you're going to do this, but it's not going to work because of this or that or other thing. So please reach out. Thank you, Davelin, for that message.
When there is a question, and I think it's going to relate probably to the similar to the prior authorizations that you mentioned about DME that's in process, because that's such a long and arduous process. Like what happens in that case? Do you have something maybe to say about that? Is that something that you're already kind of that you kind of have in mind already?
I will tell you this. If they're in the process of getting DME authorized, let's just use a wheelchair, for example, and you're not going to get that DME until after January 1st, because there's some situations that can be really complex and take longer. I can't see how Medicaid wouldn't require the new MCO to honor that. Now, is the provider going to be in that new MCO that you've been assigned to? That's a different question. If I'm using Joe's pharmacy to order my wheelchair, and Joe's been working on that PA for months, and he submits it to United Healthcare, and then you get switched to Humana, and Joe hasn't signed up for Humana. I mean, I don't know. I mean, there's questions. It's definitely some, I wrote that down, Davelin. That's a really good observation. And that's something we really need. We need some more clarification on from the Human Service District. And I know, especially in those wheelchair thing, I know those can take as much as 3 months or more. So thank you for that. I'm going to add that to my list of new questions to submit for sure.
Yeah, that was a good question. There are
Yeah.
different pieces. I mean, it does kind of go along the same lines of the prior authorization, but it doesn't mean the answer is going to be the same. So I'm glad that was a
Yeah, you're
question
right.
as
You're
well.
absolutely right. Because, you know, with your therapeutic services, it doesn't take as long to get the prior authorization back, but you're right. With the DME, particularly the wheelchairs, I think is just like the biggest issue. That's the one I'm finding takes people longest. You're absolutely right. It's a really good question. All right. Well, thanks.
Thank you for
that.
including that one.
Make some people work.
Right. Well, and seriously, for those of you who are parents and providers, because I know there are some people on this webinar who fill both roles, you're going to be able to think of some of those things that some of the rest of us aren't. So if you think of something, send it to me. I'll be happy to forward it to Ms. Karen. Contact her directly. That won't hurt her feelings either. But I just appreciate everybody's being invested in this, because it is a topic that needs to be looked at on the front end so that we can avoid any frustration or confusion. I want to remind you, please, to also do our post-event survey. You can put comments to Ms. Karen in that as well. We'll get that information to her because it's helpful to her and it's helpful to us. Tell us what you thought. Tell us what else you'd be interested in. Maybe this webinar has caused you to think of something else that you'd like to gain knowledge on. But these are free opportunities, and with Ms. Karen's investment in making things easier, you know, she's a really good resource to us. So you'll get an email here in probably before the end of the day that'll have a copy of this PowerPoint as it stands right now. There will be other resources in that webinar, in that post-event email. It'll tell you about some upcoming webinars that we have. But I want to thank you for being here on behalf of Families Helping Families of Southwest Louisiana, on behalf of Ms. Karen Scallon. Thank you for joining us. Thank you for being patient with us. And we look forward to seeing you in the future.
And Davelin, I'm going to send you the PDF as soon as we close out.
Great. Thank you so much, Ms. Karen.
Y'all take care, and thank y'all for joining today.
Thanks.